The differences between the Pfizer vaccine and the Moderna vaccine are very minimal. A lot of it has to do with storage and distribution and how the vaccine is able to be kept stable until you're given a shot. From the standpoint of when you get the vaccine, there is a 21-day wait between shots for the Pfizer and a 28-day wait between shots for the Moderna. When you look at the data from the trials, both of these vaccines have a 95% efficacy in preventing symptomatic COVID disease. They're very careful in the terminology that they use. So symptomatic disease is people who are going to report, feel sick, and get tested that way. The Moderna vaccine actually was shown to prevent severe COVID disease, and that was measured in terms of needing hospitalization and additional oxygen and some other factors like that. This is something that has a lot fewer number of cases, and so most likely Pfizer is protective as well. It was trending towards that. It's just that there weren't enough severe cases in the placebo group from the Pfizer trial to actually achieve statistical significance. So they are statistically, Moderna outperformed there. In all practical purposes, there's no differences.
I don't know if I want to say that part.
Yeah.
Because then everybody will be like, I only want Moderna.
Yeah. But that's one of the, they are very careful in how they phrase it. Moderna also tested people at, that's just, you can borrow wherever you want from it, but Moderna also tested people when they were getting their second dose, and they were able to show that they had a reduction in asymptomatic carriage. Pfizer didn't test that, so they don't have any, there's nothing to say on that front. The study design was to look at whether or not you had symptoms. They didn't test for whether or not you were asymptomatic or carrying the disease. It stands to reason that there would be a decreased disease burden and decreased transmission and decreased viral load if somebody had an infection going on in the background, but that wasn't something that they specifically measured and so or tested and looked for. So we have to be very careful on what we say is the vaccine is achieving in terms of asymptomatic infection. Right now, in the study design, you also say that Pfizer and Moderna were both careful to say that this provides protection for at least 2 months. Data that looks at natural infection will tell you that you have protection for 90 days or 6 months, depending on which study you're looking at. To me, they were very careful in using that 2-month time period because that's where they had available data. Now, the idea of getting a first shot and a booster shot really allows your body to hone in and make better antibodies and more defined antibodies to the coronavirus. And while we don't have a set time frame on how long those antibodies or how long you'll be protected from this virus at this point, my guess, my hunch would be that this is going to be as long as a natural infection and most likely longer, just because of that second challenge. You don't necessarily get a second challenge like that in the case of a primary infection. Yes, I got the shot today.
When will you have some immunity? Like how soon does that start, or how long does it take to build up enough in your system?
So the recommendation obviously is for 2 shots. When you look at the antibody titers that appear in people's blood over the course of an infection or a vaccination in this case, your antibodies take about 10 to 12 days before they start to develop. So in theory, I should have some form of protection, although not complete protection, starting in about 10 days. When you get that second booster shot, you are definitely able to see an increase in productive neutralizing antibodies, or the antibody titer to COVID is definitely increased after the second shot, and that was uniform across all age groups.